So one of our challenges in thinking about evaluating medications is clinical meaningfulness and defining what that is from a patient perspective, and also matching that with the development of outcomes to measure that in a way that payers understand, patients understand, healthcare providers understand. We really need to get to that place of clinical meaningfulness across the entire SMA community, so that we better understand it and can be efficient in our assessments of new potential treatments. Spinal muscular atrophy is a rare disorder, and if a healthcare provider has never seen it in their career, it's challenging because they won't recognize it efficiently. And that's really been the crux of treating SMA, is early recognition. We know through the clinical trials of each of the therapies that are available, they've studied their treatments in pre-symptomatic infants. We know that regardless of the treatment, the sooner treatment is initiated, the better the outcome, regardless of the treatment. And honestly, my entire career as a healthcare professional, which is over 25 years, the struggle has been educating healthcare providers to recognize this disease early. So what now, with the first treatment that became available, we were able to put that forth, recommending newborn screening. So because we have a treatment, we were able to say that if you screen for these infants at birth or shortly after birth, we will be able to initiate a treatment that will dramatically alter this disease. So we're at the 2-year anniversary of the approval by the recommended uniform screening panel to add spinal muscular atrophy to newborn screening. And currently we have 33 states that have implemented screening for SMA, which represents 68% of all infants born in the US. So we're making great progress. Our goal is to get to 90% of all infants born in the US by next June, the time of our annual conference in 2021. And that will facilitate getting treatment to these patients much sooner, individuals with SMA much sooner. However, we need to keep in mind that there's still 5% of individuals who will be born with SMA who will not be recognized by newborn screening. So those infants will go on to develop symptoms, and an astute clinician still needs to be able to recognize SMA and do the appropriate referral and testing. So yes, the early diagnosis and recognition, as we talk to families prior to newborn screening being available, the greatest frustration is something that is called the Diagnostic Odyssey, where families recognize that there's something wrong with their child. Their child is not making the developmental milestones. They're alert, they're smiley, they're happy, they're interactive and engaging and adorable. I have to say, that's how I got kind of hooked in, was a baby smiled at me in clinic, and it was an infant who had just been diagnosed with SMA recently, and they referred to me for pulmonary care. And as I looked at this infant, they looked at me like they knew something I didn't, and I better get my stuff together and help them as quick as I could. It is that sort of an experience caring for this population, which is so cool. But newborn screening will definitely go a long way in the early diagnosis and treatment, but it also is not perfect. There's still 5% that will be missed and need to be diagnosed clinically.